It's a Friday, and you know what we do on Fridays at this time? We talk about our health. Welcome to your Health 360 with me right here, Jacqueline Adebija, with you at your service this evening. How's everyone doing? I do hope that we're all at least in the kind of state of mind or state of body where we're looking forward to the weekend. Like you know, on Your Health 360, we talk about everything and anything that concerns our health. And indeed, in the last few years, there has been a resurgence of different diseases that we thought we had, gotten over with, we had done something about, we had lowered the numbers or completely eradicated or eliminated from our country. And we're seeing a resurgence. Now, for some people, it's not surprising. For some, it is. But I think the most important thing there would be, why are we seeing that should be the more important question. Why are we seeing a resurgence? What are we doing wrong, or what are we not doing anymore that we were doing before? Anyway, this evening, to come help us talk this on Your Health 360 on leprosy, a resurgence of a forgotten disease, is Dr. Sadiq Idris. Dr. Sadiq Idris, you're welcome to Invicta. Let me quickly tell us that we're live on Facebook, and so we can all quickly just follow us on Facebook. Like I said, for those who miss it, you can actually go on YouTube and check us out much later. That would be nice. It would be great if you could do that. Like our page and, of course, subscribe. It would be nice. All right. So, Dr. Sadiq Idris, welcome to Your Health 360. It's good to have you here.
Thank you very much. It's good to be here.
Now, talking about leprosy, let's start from the basics. What is it actually? Because when I was, going through trying to find out why all of the resurgence and all of that, I read one man's experience. And the man said, for him, it was just like malaria, the way he was feeling. That general feeling of malaise, just fatigue, feeling down. Of course, he saw different patches on his skin, but he didn't think anything much of it. And so he kept going and coming, and it seemed like the malaria wasn't leaving. And it almost got out of hand before they realized that indeed this man was had been infected. Yes, having leprosy. So what exactly is leprosy? What causes it?
And thank you very much. Leprosy is a chronic infectious disease that is caused by a bacteria called Mycobacterium leprae. And it usually affects the skin, the mucous membranes of the upper respiratory tract, and the nerves. And it also affects other parts of the body, such as the face, the eyes, the legs, amongst others. So it has various manifestations depending on the degree of the infection. But first of all, like that man noticed, the principal sign a person notices is a patch that is hypopigmented. What we mean by hypopigmented is that the area that is affected is not as dark as the surrounding area. That is one. Then there is loss of sensation. That is principal. Within that circumscribed area, there is no sensation. So even if this is the only sign an individual notices, there should be a high index of suspicion that this might be leprosy. Then it can also affect the nerves. So this manifests as loss of sensation if it is cutaneous nerves, either in the hands or the legs, or it can affect the ability of a person to utilize his limbs. For instance, weakness in the hands, weakness in the legs. And these are only the early signs. If this is identified early and the patient is placed on treatment early, then we will prevent complications. And the complications usually arise from these signs. For instance, the loss of sensation. An individual that doesn't have loss of sensation can easily get injured, and the patient can develop a lot of ulcers, chronic
there. And does it matter the vector? Does the vector matter? And in any case, I don't know whether you have told us what how do we get it?
Yes, that's important. The transmission.
Yes.
It is usually an airborne or droplet transmission because it affects the upper respiratory tract, and it can manifest in the form of coughing, sneezing. So through this means, the droplet is released into the air, and an unsuspecting individual that comes into contact with the infected patient actively releasing this mycobacterium inhales this. It goes into the mucous membrane of the individual, moves to the nerves, and manifests as leprosy. But it has an incubation period. Usually, it doesn't manifest immediately. It takes time, something ranging from 2 years to 5 years, sometimes even to 20 years before you have the full manifestation of the signs and symptoms of leprosy. So, what are the factors that easily lead to this transmission of infection? You see, when you have an infected individual that is not on treatment, that is the major cause of transmission of this disease. Then when you have an overcrowded environment or an overcrowded and unhygienic environment also leads to spread of this infection. When you have an environment that there's no ventilation, leads to transmission of this infection easily, because since it is transmitted through the air, it makes sense that if the place is overcrowded or the place is doesn't have good cross ventilation, it increases the number of mycobacterium within the atmosphere and increases the chances of people actually inhaling this bacteria and getting infected. And it's not everyone that comes in contact with this mycobacterium that becomes infected. In fact, more than 95% of individuals actually don't become infected with the mycobacterium.
So what makes the difference?
It might be the nature of their immunity, because immunity plays a big role in the transmission and progression of leprosy. In fact, it is the major determinant of the clinical signs and symptoms you see in the classification of leprosy, whether it is paucibacillary leprosy or multibacillary leprosy. So it might be because of the immune system. More than 95% of people don't become infected. So it's the less than 5% of people that actually become infected with leprosy. And even that is to a varying degree. And it can be multibacillary or paucibacillary. What this means essentially is if an individual has a high level of cellular immunity, which prevents us from getting infections, then he is likely to have paucibacillary. And it usually manifests with lesser signs and symptoms. You see less skin patches, you see less nerve involvement, less deformity. But in multibacillary, the individual has less or very weak cellular immunity, and it has more severe signs and symptoms. That is where you see a lot of the nerve involvement, skin involvement, you see deformities and more severe reactions. So, but there's one thing I should mention. It doesn't just affect the hands and the limbs or the face. It can also affect the eyes. Yes, because the muscle, we know nerves supply the muscles and aids in movement. So the upper eyelid is also controlled by one of the nerves that is easily affected by the bacteria. So when there is this affectation, it reduces the degree to which the eye closes. And we know that the closing, this blinking we do, has its purpose. It nourishes the eye, it reduces the chances of it getting dry. So in this kind of individuals where even when they are asleep, you see that the eyelid doesn't close completely. So there is exposure, undue exposure to the eye. And this increases dryness, and it can also cause scarring, which can progress to blindness.
You know, I'm still not clear about how human beings get it, because what we were told growing up is that cockroaches are the vectors, just like we know that mosquitoes carry malaria.
Yes.
We were told that cockroaches carry leprosy. But reading up, I see that it's not just cockroaches. Seems as if there are quite a number of vectors. I don't know if you could clear that up for us. Do we have a major vector for this organism that causes leprosy?
Well, man is actually the major reservoir
Really?
of leprosy. So the infections you see usually comes from an infected, untreated individuals. So things like cockroaches are actually not involved in the transmission. It comes from an infected person, and the way it is transmitted is when he actively releases the mycobacterium through sneezing or coughing or sneezing, and it is expelled into the air, and someone inhales it, and it goes directly into the individual, the mucosa of the upper respiratory tract of the individuals, where it multiplies and moves to other parts of the body.
So you can't contact it from surfaces. Say, for instance, someone who has leprosy has some body fluids that, were on the limbs or something, and the person touches something, for instance, and then you go and touch it a little bit later. Can you contact it from that surface, or it has to be an active sneeze or something that could expel?
No, thank you very much for that statement. It's actually, well, even that comes from an infected individual, but you are right. One can actually get it from contaminated surfaces, because research has shown that the bacteria can actually last for between 2 to 5 and even sometimes to 9 days on surfaces if the environment is conducive. And so, just for instance, an individual touch a surface that has been contaminated, and he touches any part of his mucous membrane. It's easily when you touch your eyes, your mouth, your nose, infections can easily go through there. Just for instance, the COVID-19, it can also get transmitted through mucous membrane as apart from the atmosphere. So one can also get it if he comes in contact with a contaminated surface.
So this is really saying something, Dr. Sadiq, because my mind just went to money, legal tender, when you were talking about, the bacteria lasting for 2 to 9 days if the environment is conducive enough. My mind just went to money, the way we handle money. You see a lot of us folding money and putting it in our bras. A number of us, handling money. And we use, wet our fingertips with our tongue so that we're able to count
the money
better. Money that has been, back and around. Anyway, so talking still on this matter, I was surprised to see that it's not age specific. So that means that whether you're an adult or whether you're a child, you can actually contact this.
Yes, you are right. It is not age specific. Any category of individual can actually contact the infection and actually manifest the signs and symptoms of this disease.
But the symptoms will be the same?
Yes, the symptoms are the same, depending on the degree of immunity of the individual.
But
So-
is it every time, doctor, that you will be able to see this discoloration and then, of course, try to observe if you are losing feeling around that place? Because when I was reading up on the account of this man, it seemed to me like he didn't even think much about those, because
Yes.
it looked like they were tiny. You know, they started tiny, those colorations that we're talking about, people losing pigmentation. It wasn't like large enough to disturb him, and that's why he was thinking
Yeah, he was
along the lines of
hesitant.
malaria, and even went to the hospital and they were thinking it was malaria. So
Actually, there are various skin manifestations. The skin patch is just one of them. It might come in form of what we call a papule, a macule, or a pustule. And this will look like the normal, some of them will look like the boil, some will look like pimples, some will look like, it can be in a form of heat rashes. These are some of the manifestations. But the general one that easily one will identify is the patch, which is hypopigmented, and there's no sensation. So the moment you are able to pick that, then you have a high index of suspicion that this might be leprosy. We know there are a lot of skin diseases, a lot of them, but there are some things that you can use to actually exclude or limit the particular skin disease you are thinking. For instance, even if there is a patch, but there is no loss of sensation, it might be another infection, or it is itching. If there is itching, then it might not be leprosy. It might be another thing. Or if it is scaling, it might not be. It might be from a fungal infection. We know there are a lot of fungal infections that can mimic, but the moment you have itching, you have things like pain, even, or you have the discoloration being dark black, dark red, silver, or one of these
Funny colors.
then it's unlikely to be leprosy. So the key issue is the index of suspicion, which even in our health facility, unfortunately, is really not there, or it is limited, because you can have an incidence where a patient will go there, but they might not think towards the line of leprosy, which is one of the things I think is actually leading to more cases, because we are actually missing a lot of these active cases that result in a lot of transmission and increasing the cases we are seeing. For instance, in around in the 80s, mid 1980s, we know we had a lot of leprosy cases globally, over 5 million. But because of the introduction of the multi-drug therapy, it kept decreasing significantly. And to an extent that in Nigeria in 1998, we were able to meet the World Health Organization target of leprosy elimination, which is less than 1 leprosy case per 10,000 population. But in some point, the cases began to rise, not just in Nigeria, but globally. Nigeria is one of the 23 countries with high burden of TB, with more than 90% of leprosy cases globally, and we have around 15% of leprosy cases in Africa. So we actually have a significant number, and I think the reasons is because of the neglect leprosy has suffered. At some point, there is a lot, in most of the interventions stopped, most of the attention given to leprosy stopped, and it was forgotten, thinking that we have done a lot, considering the effort that we have made to actually lead a global result to a global target of elimination. So all this, coupled with the advent of resistance to some of the drugs used in the treatment of leprosy, all this led to the resurgence. And if we really want to tackle the issue of leprosy, then we'll have to sit back and re-strategize, bring out interventions that will involve active case finding through community activities, community outreaches, so that we'll find those cases, massive community enlightenment, so that people will know what the signs and symptoms of leprosy are, so that they will be able to go to the health facility and get diagnosed and get treatment. Treatment is available and it is free. Then we'll have to engage in the carry out stakeholder engagement, because we need stakeholders within our communities, traditional rulers, religious rulers, political rulers. We need everyone to join hands to see that we bring an end to leprosy. We also need to bring in other interventions apart from the active case finding, such as integration of leprosy management in our general healthcare system. Because if we are able to integrate it, it means every facility a patient goes, he is able to get services for leprosy. At least they will be able to screen and either presume if he has leprosy or not, and that will aid in the next line of actions, final diagnosis and management.
Instead of this malaria that this man was being told that he had, until he was able, lucky him, to access someone who said, look, you better
this might be leprosy.
Well, yes, this might be leprosy. Go and get yourself checked.
Exactly.
Let me ask you, Dr. Sadiq, you talked about the incubation period between one coming in contact with the bacteria and its manifestation. You talked about sometimes even 2 years, even up to 10, 20 years.
Yes.
Now, my question is, in that period, when that person, between that time when the person contacted or had contact with that bacteria to the time that it starts to manifest, can that person spread the bacteria to other people even before they have manifested?
Well, the truth is that even before manifestation of signs and symptoms, an individual can actually transmit the disease. So the question is the duration. For instance, we said transmission is usually via droplets through the respiratory tract. So if the patient is having those prodromal symptoms, then he will actually continue to transmit it. And at some point, we know what delays the manifestation of the clinical signs and symptoms is the immunity of the individual. If the immunity of that individual is able to check the multiplication of the disease, then we can have a stop until a point in which the immunity can no longer handle the infection and you have outright manifestation of the signs and symptoms of the disease.
So that person can, of course, spread it even before we start to see physical manifestations.
Exactly. You can spread it even before.
Another thing that surprises me, or is surprising, Dr. Sadiq, is when you were talking, of course, you made mention about the person's immunity, and my mind started going to HIV. I do know that there's a link between tuberculosis, HIV, and of course, leprosy. Probably some people would say it's part of the reason why we're seeing a resurgence. But for me, it was quite interesting to see that in Africa, amongst those 23 countries that are carrying the burden yes, of leprosy in the whole world, in Africa, I saw that there was Nigeria, Ethiopia, Mozambique, Tanzania, the Democratic Republic of Congo, but I didn't see South Africa. The reason why I'm asking is, I thought that a country like South Africa has a high
burden of HIV should
exactly would have this burden of leprosy, but surprise, surprise, South Africa was not a part of it, and I'm wondering why. What is playing out there?
This might be because right from the onset they were able to initiate interventions that actually significantly lead to a decrease of the number of leprosy cases. And additionally, it's possible they have an active surveillance on ground that identified leprosy cases and manage them immediately, thereby reducing ongoing transmission of the infection. So despite the high burden of HIV, you don't see leprosy being a major challenge there.
Now, stigma, like we've been challenging discrimination against people for different things, and stigma against people who either have loved ones or have themselves passed through the infection of leprosy is another thing that we have to fight against. Yes. However, how do we manage that, especially in a society where, you know, we all enter the same commercial transportation and handle money that has been everywhere and anywhere, you know, just about the fact that we really do not have those, and then also not really wanting to start to stigmatize people and say, oh, you know, because you're a leper or because you're suffering or living with leprosy, you cannot access this public transport. So I guess I'm asking, how can we manage both? How can
balance
we
between the fear, because it's the fear that actually leads to the discrimination,
right,
and the human or aspect. Issue of discrimination has been a major challenge with lepers. Historically, it has been like that. A lot of people have been afraid of going close to them because in fact there are a lot of misconceptions, thinking that, oh, the moment a leper touches you, you become infected. I know there are issues of having clusters of lepers, or a family you have 2 or 3 lepers, but what leads to that is because of the proximity of interaction and the fact that the infected individual was not placed on treatment. But if the infected individual has been placed on the right treatment, he becomes non-infectious and he becomes cured, and he is no more a threat to any other person.
Even when their limbs have fallen off, or
in fact, most of those you see with chopped off limbs and the severe manifestations, at that stage, most of them are non-infectious. Most of them at that stage are actually non-infectious.
That's really interesting.
The infectious stage is usually early when they are having those signs and symptoms, especially the upper respiratory tract, because that is the major route of transmission. But those ones that have been, in fact, they have been lepers, or they have the serious adverse effects of having leprosy for several years, they are non-infectious. So they are not the ones that one will be afraid of. One should actually be more afraid of those with early signs and symptoms, and that should actually trigger us to take action, so that those individuals will be placed on the right treatment. Because the moment you are able to prevent active transmission, then you'll be able to bring an end to leprosy.
Talking about those respiratory signs, Dr. Sadiq, is it coughing, sneezing, runny nose that we're talking about, just looking like the ordinary cold?
Yes. Those are the normal cough, sneezing, runny nose. Those are the early signs. And you know, it's true there. A single sneeze can lead to release of several hundreds of thousands of the bacteria, because it is very tiny. So it can easily spread to other individuals. That is the major route of transmission.
What's the data in Nigeria looking like? What's within Nigeria? We know that Nigeria is one of the 23 countries out of 195 countries in the whole world carrying out of this burden. But within Nigeria, what's the picture like? Where do we have more of people living with leprosy?
Okay. Well, for the past 5 years, the average number of leprosy cases in Nigeria is around 2,500. It fluctuates but averagely it's around 2,500. But the major states with the infection include what we have Kano, we have places like Gombe, we have places like Jigawa, places like Cross River, places like Ebonyi, places like Taraba, having more cases when you compare them with other states like Kaduna. Kaduna State is one of the states with lesser number of leprosy cases. If I remember correctly, last year in 2020 we had 30 cases of leprosy, but we should not be deceived. This is, in reality, is not telling us that these are the only number of leprosy cases, because the interventions that is going on for leprosy is actually minimal, or in some places actually non-existent. We focus more on other disease conditions than on leprosy, so it has been neglected. If you carry out maybe a mapping of where we're having those leprosy cases, and you take a community intervention there to try and screen and identify leprosy cases, you are likely to have a lot more of leprosy cases. So the call here is for everyone, both the government, private individuals, people within the communities, to actually come out and support interventions that will aid in active identification of leprosy cases. Because if they remain there, they will continue to spread. Even though they are below the radar, we are not identifying them due to limited interventions, but there will be a kind of silent epidemic of the infection going on.
As a matter of fact, when you know or recognize Kaduna's unique position as the most cosmopolitan town or city or state in the north, where almost everyone passes through, you'd understand that. I mean, we need to really be up and doing.
Exactly.
And of course, who would have thought that a virus from Wuhan in China would impact on the whole world like this? I mean, we're going on 2 years trying to battle the coronavirus, and it started from just one place.
True.
So
one of the major drivers of infection, especially for leprosy, is migration. People moving from one location, an endemic area, to a less endemic area, and bringing the disease along with them and spreading them. And we know a lot of places such as that have a lot of unrest actually have a lot of leprosy cases. And we know because of the insecurity now, insecurity challenges, you have a lot of IDPs, internally displaced people. So there's likelihood of people moving from other states to states with less incidences of leprosy and bringing the leprosy along with them.
If you're just joining us this evening, we're talking about the resurgence of a forgotten disease, talking about the resurgence of leprosy. And with me in the studio, Dr. Sadiq Idris. Let's go on a quick commercial break. We'll be right back. And of course, as soon as we get back, we start to take your questions. Stay with us.
Your Health 360, only on Invicta.
Thank you for staying with us. Your Health 360 this evening with Dr. Sadiq Idris in the studio with us, talking about the resurgence of leprosy, a forgotten disease. Time for us to get to hear from you. What are your questions? And it would be nice for us to try to talk about this, because indeed there is a resurgence. The numbers are 081 40,000 989 and 07087 800 989. Once again, that's 081 40,000 989 and 07087 800 989. Now, while we're waiting for those calls, Dr. Sadiq, you were saying something about, the work you're doing, in the state. I think it would be important for the people to hear about this.
Yes, thank you very much. I was highlighting the fact that we have an existing structure within the state Ministry of Health, the Tuberculosis, Leprosy and Bruley Ulcer Control Program, where we have over 866 facilities that are providing services. And any of this facility can actually provide service for both leprosy and tuberculosis. So when we are thinking about access to the services, are these services there? Can we get treatment around us? We actually can, because any of those facilities can support the patient in identification and drugs. Any patient that has been identified, no matter the location he is within the state program is able to actually send medications for the whole duration of treatment for that particular patient.
Is this free of charge?
Yes, it is provided free of charge. Just as the medications for tuberculosis are being provided free of charge, even for leprosy is provided free of charge.
We have that intervention right now in Kaduna State.
Yes, we have that intervention.
That's interesting. We must make use of that. We must make use of that, especially for people who are in the villages. Well, looking out for your thoughts and comments this evening, still on the number 081 40,000 989 and 070 87 800 989. Let me go check and see if we have any text messages this evening. All right. Okay, we have somebody asking, please always drop your names if you want me acknowledging. This person is saying, how many types of leprosy do we have?
Thank you very much. Leprosy is actually caused by a single bacteria, Mycobacterium leprae. But we have classifications based on the clinical manifestations and based on the cellular immune status of the patient. So we have the classification of multibacillary leprosy. We also have paucibacillary leprosy, depending on the immune status, where we said in terms of the paucibacillary, the immune status, cellular immunity of that individual is quite strong, and in terms of the multibacillary, the cellular immune status is low. Then we also have classifications that range from tuberculosis, it is a spectrum. At one end we have lepromatous leprosy, we have borderline lepromatous leprosy, we have borderline leprosy, then we have tuberculoid leprosy, we have borderline tuberculoid leprosy, and all this is dependent on the degree of the immunity of that individual.
Not on the kind of bacteria.
No, it's a single bacteria, so it's just the immune response of that individual that determines the manifestation and the classification.
All right, still taking your questions this evening. We have someone here also asking, is it the leprosy that causes the chopping up of the nostrils? I think is what this person is trying to ask.
Okay, one of the manifestations. Okay, he's talking about some of the manifestations of leprosy.
Yes.
Yeah, it can affect any part of the face too, and it can cause deformity. So the mucous membrane, the cartilage of the nose, can also be affected, and sometimes you have nodules developing in the face, deforming the whole face, the nostrils, the nose, the forehead, other part of the face, the earlobe. All this can happen, and sometimes reactions, because there can be reactions from the cellular immune response of the individual, leading to adverse reactions, not from the medications, but from the immune response of the individual to the infection, also leading to various forms of deformities that will need to be managed.
Okay, so just as a follow-up to this person's question, I'm asking this now. Talking about the nostrils and the fact that people are quite active when in spreading, when we least expect, when they're just exhibiting respiratory signs. Now, you also said at the point when we see people, far gone
with all the serious deformities,
right? It means, at that point, they're
it's
not
unlikely that they are actively spreading the infection.
Right. So what then would you say about those that we see who have, say for instance, deformed nostrils, and you can see that they are dripping. You can see that they have fluids dripping from their nostrils, because that I've seen. So what about in such situations?
Yes. So in such situations, the first thing that should come to your mind is that patient has that patient been treated? Has he taken the medications? If he has taken, then there is actually nothing preventing him from having the normal upper respiratory tract infections that will cause such signs and symptoms. And he might actually, if he has not been treated, he might actually be releasing the bacteria through those upper respiratory tract signs and features. And again, it might also be from the adverse effects of
Doc,
the environment.
Let's so that this person can talk to you.
All
I know
right.
a lot of people might want to. Hello, good evening.
Yeah, good evening.
Yeah, please go ahead with your question. Don't forget what you were saying so that you can finish up. Yes,
Okay.
go ahead, please.
All right, thank you very much. Doctor, thank you for your explicit presentation.
Thank you.
I want to know, in Kaduna, you said Kaduna had 30 cases as of last year or thereabout.
Yes.
Okay. Are there any intervention by Kaduna State government in, taking an intervention to the community to test people around in order to get more values before we will conclude that it's just 30? And secondly, are there asymptomatic cases of leprosy such that somebody will be harboring this virus without coming down with any complication? And if there are, what are the telltale signs to inform the masses or individuals that this may be carrying this virus?
Okay. All right. Thank you for your question. Did you get everything you were saying?
Yes.
Yes. Okay.
Thank you very much for your question. You are quite right. The fact that we're able to get 30 cases doesn't mean we only have 30 cases. That is why I mentioned earlier that we really need to strengthen the level of interventions, to be more active, to target, to try to identify cases. Currently, what is done is integration of the community interventions along with that of tuberculosis. So when we do community outreaches for tuberculosis, we use the opportunity to also enlighten and screen people for leprosy. But there needs to be a lot more effort. And I'm sure this is not something for the government alone. We also need people, private organizations, private individuals, entrepreneurs to also come in and support the process. And for your second question, it is true, someone that is not having the active signs and symptoms, the obvious manifestations, might be able to also transmit the infection, well, as we have discussed earlier. So there might be asymptomatic individuals with early signs that one who is not a health worker might not be able to pick, but he is transmitting the infection. So that is why we need to have high index of suspicion. Anything we see that is different, that we don't understand, let's quickly go to the health facility.
All right, let's take another call. Hello, good evening.
Hello, good evening. You're on to Nehemiah from Karachi.
You're welcome. Go ahead, Nehemiah, quickly.
I want to know, do leprosy have any issue with ringworm? Because some people will say ringworm is it gets what the body is prone to leprosy. I don't know how true it is.
Okay. All right. The doctor will answer you now. Thank you, Nehemiah.
All right. Like we said earlier, there are a lot of skin infections that one will have to exclude to when compared with leprosy. For instance, a ringworm. In fact, a lot of fungal infections, and ringworm is one of them. It is different when you look at the characteristics compared with that of the skin patch for leprosy. So for ringworm, you see a clear circumcised circular area with scaling along the edges. But usually there is no loss of sensation and there is itching along the outer edges. So that is for ringworm. But in leprosy, the skin, you see a hypopigmented skin patch and there is loss of sensation and there is no itching, there is no pain. So these are two different things. If you are not able to, it is not necessary for you to be able to differentiate this. You might need a clinician to actually differentiate this and give you the appropriate treatment.
I honestly think that with, what we've heard from Dr. Sadiq today, it's important that, those skin infections, it's better to err on the side of caution.
Exactly.
And just get yourself to a hospital and, let the doctor take a look at it and then free you, instead of you to say, oh, this is eczema and, oh, this is this. And then you have a case of leprosy that you don't even know about. I think it's so. But Dr. Sadiq Idris, thank you so much for being with us this evening. Your last line to the people would be?
My last line is, leprosy is actually with us. It has not gone anywhere, and we need a concerted effort to try and see that we identify those leprosy cases and treat them in order to prevent transmission and prevent the deformities and the associated social, economic, and other factors that comes along with it. And we should all try to see that we do not discriminate against people afflicted with leprosy. We should try to support them. We should try to provide means economic empowerment that they can actually do and support themselves. Thank you.
And thank you so much, Dr. Sadiq Idris, speaking to us about the resurgence of a forgotten disease, leprosy. Like I said, if there's anything that COVID has taught us, it is that we shouldn't say, oh, this is their problem or this is those people's problems, because indeed it will come back to our doorstep. Once again, thank you, Dr. Sadiq.
Thank you very much.
Of course, this is saying Ramadan Kareem to all our listeners out there who have just broken their fast like Dr. Sadiq did and came in here almost immediately. Thank you. We appreciate you.
Thank you
For
it's my
doing
pleasure.
that. Until next Friday, people, ensure that your health is topmost amongst the things that you care about. Stay victorious.